Hi there. Welcome back to the Complicated Kids podcast. I'm your host, Gabriele Nicolet. I am a toddler whisperer, a parent coach, and a speech therapist. And today I have Dr. Jodie Dashore here with me. Dr. Dashore, welcome.
Thank you.
I'm so happy that you were able to be here. And we are going to talk a lot about autism today, what it is, what it isn't, what we're looking at, what we might not be looking at. But before we get started, I wonder if you can just give us a little bit of background of who you are and what you do.
Yes, of course. I am a master herbalist and autism specialist, Lyme literate clinician, SIRS mold biotoxin illness certified practitioner, sensory integration certified, uh, doctorate in occupational therapy. I have a PhD in integrative medicine. I'm board certified in integrative pediatrics. And way back, my background is special interest in pediatric neurology.
So, you have a lot of experience and education. Let's just put it that way. And so, given that we're going to be talking about during this podcast, do you want to set that up for us a little bit?
Oh, absolutely, yes. So, would you like to hear about autism from my perspective?
Please
What I've seen over the years? Yes, it's been more than a couple decades, personal and professional experience. So,
walk us through, please.
oh, absolutely, yes. This is going to be awesome. Well, with autism, if we look beyond the classic presentation of autism with behavioral, social, and communication issues, and try to dig deeper to look at the internal physiological issues, physiological and biochemical changes that most children might be going through. And many are nonverbal, unable to express, and this translates into difficult behaviors in children, which is, classified as autism, level one, two, and three. Now, over the years, this classical autism, several studies have confirmed, as I'm sure you know, Gabrielle, neurological challenges, immune dysfunction, mitochondrial dysfunction, also metabolic issues like leaky gut, poor digestion, malabsorption, nutritional disorders. Now, of course, there are established biomedical protocols to help with mitigating these challenges along with symptom alleviation. The biomedical approach can be quite effective for many
Hmm.
with the usual, the diet, the supplements, and therapies, etc. But it does fail for many as well. It is in these treatment resistant children that numerous unusual symptoms are often observed. I don't know about you. You must have seen some, I'll bet, but I've seen symptoms like Bell's palsy, which is the facial paralysis of one side. I've seen severe muscle weakness, sometimes just hemiparetic on one side of the body, low muscle tone to the point where the child is unable to chew their food. I mean, let alone talk. It's not going to be possible until that issue is resolved. We've seen joint pain, stiffness, liver enzymes elevated, kidney issues, shortness of breath, cyclical fevers, red eyes, atypical skin rash, vision issues, and these are a far cry from your classic picture of what autism looks like.
I want to pause here because what you're describing is that we take note of, I'll do this badly, but we take note of physiological and neurological symptoms. Like, I mean, Bell's palsy, not a behavioral thing, right? That's
Exactly.
clearly coming from internal. Now, I am one of the people who say behavior also coming from inside. Okay, fine. These symptoms that you're describing, these are outside of a behavioral social diagnosis of autism, in which we can have a very healthy child with autistic symptoms. or at least externally presenting. But the children you're describing here, they are sick, they are ill. Yeah.
Exactly. And it is quite interesting how, and I'll describe my personal experience as well. It's quite interesting where unusual symptoms are just kind of lumped under the same umbrella of autism spectrum disorders. That's precisely what happened, Gabrielle, in 2009 with my son, where these unusual symptoms, he was around 6.5 years of age, diagnosed at 18 months, um, self-diagnosed by me. It was pretty obvious what happened, but that's a whole other story. Now, you know, coming back to succinctly explaining how I landed where I am today is these unusual symptoms were just classified as atypical autism, and that was that, right? Now, when things progressed to paralysis, a wheelchair, excruciating bone pain, violent motor and vocal tics, serious anxiety, paranoia, constant coughing, difficulty breathing, failure to thrive. I mean, just stopped growing, lost weight, and at one point was given 2.5 months to live.
Oh, wow. That's
And
extreme, and that is not autism.
that isn't autism, right? Now, we ended up seeing 19 specialists in 12 different states and 4 countries we had to travel to, and slowly took 7.5 years to crawl our way back out of this abyss.
I want people to notice that length of time, particularly when I used to take speech therapy clients and they would say, well, how long are we going to be here? And I would say, mostly because I didn't want to put anybody off, but I would say we need to think in terms of 6 to 12 month chunks.
Right.
Right. And that is a reasonable amount of time to make some progress, assess progress, and decide whether you need to continue. Is the likelihood that you need to continue? Sure. Yes. But 7.5 years, if you had told yourself at that point, right, this is going to be a 7.5 year journey, would you have packed it in or would you have kept going? I don't know.
For me, there was no choice.
Yeah.
We had to get him out of a wheelchair. We had to give him, I wasn't looking for any kind of a cure from autism. I'm perfectly okay with neurodiversity, and I am, absolutely comfortable with having a special needs child. By God's grace, I had the qualifications to help him navigate his life through that. But the pain, the neurological, the psychiatric, the brain I mean, the brain on fire, pretty much the body on fire, being in a wheelchair, going to school in a mask because of immune deficiency. No one, and not at the age of 6.5. I mean, he lost his life. He wasn't able to go back to taekwondo, gymnastics. It was during baseball practice was where he just collapsed. His left leg just gave out under him, and we had no clue. And it just progressed to full-on paralysis. His left leg was dragging behind him. It progressed upwards. His hip was massively infected. So overall, we found out with Brian. Brian's my son. Um, Issues like PANS, pandas, tick-borne infections like Lyme disease. Now, PANS, pandas is autoimmune, and we can, later on, if there's time, we can get into that. But there's a lot of information available online, right? So there's brain on fire or autoimmune conditions like PANS, pandas, actual life-threatening infections, tick-borne infections like Lyme disease, and environmental toxins that can be equally life-threatening depending on your genetics. So CIRS, or chronic inflammatory response syndrome. So the problem was we discovered things one by one. It wasn't like today, if any patient comes to me, I mean, hindsight, right? If only I knew back then, what I know today, like the first hour, the initial evaluation, when I first meet with a patient, they get all of this
Yeah.
in the first appointment. And it took us, a 7.5 year journey for Brian to recover. But, like uh, the symptoms from these recognized medical conditions, now they are very well recognized, and after all these years, are so very similar to autism that many children may very well be misdiagnosed. Dare I say misdiagnosed? But yes, that's what I've seen in my practice. Or at the very least, they can have a huge potential of recovery from all of these symptoms.
And oh gosh, there's so much I want to do here, and we could spend all day, but I think it's so important what you just said, which is there are debilitating, life threatening symptoms and illnesses that get labeled under autism. Those two things, I think you're making a really, for me anyway, a very clear case. Those are not the same. And whether or not someone is autistic doesn't really matter if they're sick, right? Like,
Yes.
these may be autistic children who have an illness. And to your point about neurodiversity, all brains are different. I don't even know who we're diverse from. Um, and that is a different conversation for a different day.
Right.
But you are describing, again, a child who may have a brain that works in a certain way, who is also sick. And it may be, you tell me about this, that form of, well, I'm going to ask you the question. Does neurodiversity, does an autistic system, does that make one more susceptible to these types of illnesses, symptoms, conditions? I don't know the answer. Maybe you do.
The answer is no.
Okay. Yeah.
I have several neurotypical children that have the very same illnesses, but in neurotypical children, it is not lumped under the umbrella of autism.
Mm-hmm. Mm-hmm.
So, unfortunately, when children are nonverbal, most of the manifestations of underlying pain, distress, confusion, headaches, right? At one point, when my son was learning to speak again, and he was functionally nonverbal. He had quite a number of words, but couldn't string them together. They were mispronounced, a lot of dyspraxia going on at the point. But eventually, when that happened in fourth grade, and I heard he would come to me, hold my hand, and say, "Mama, brain shivering."
Oh, boo boo.
So it was heartbreaking. I once found him. Um, I was always around him. Sorry, I get a bit emotional, but I was with him, and I went to get him a snack and he wasn't there. So I figured he went upstairs to his room. I Something gave me anxiety. I ran up the stairs and I saw him standing by his bedroom window. Window was open.
Oh, oh.
And then he looked at me, and long story short, he was going to jump because that's when he said, "Mama, brain shivering."
Oh, honey.
And he didn't really know what to do about it. You see so many children that have, excuse me, I just get emotional. Um,
It's an emotional thing. I have truth bumps, as some people call them, all over my body right now, thinking about, and it's something, you're right. We don't think enough about whether children who are misbehaving, who are needy, crying, fussing, whether they are in pain.
right.
This has happened to me in my own family. I had a niece who, at age 1, I was quite concerned about developmentally. Well, it turned out she had a serious medical condition and she was in severe discomfort at all times, mostly in the afternoon when I was seeing her.
Yeah.
And it at that time did not cross my mind. And I was used to looking through this developmental lens, which I think is the error that many practitioners who deal with autistic children are doing as well. We're looking through this developmental, behavioral, psychosocial lens, and we're not looking through a neurological, physiological, intestinal, system-wide
Oh,
endocrinological,
yes, yes,
right?
absolutely. There are so many. One of the things that we look at is at all different kinds of toxins.
Mm,
So yes, looking at endocrine disruptors, looking at biotoxins from environmental exposure, from infections, underlying infections. I mean, we know that immune dysfunction is associated with autism for decades.
mm,
Now, understanding the immune system, your innate and your acquired or adaptive immune system, not too many dive that deep. And that could be a huge missing piece. I mean, coming back, right? So, an important aspect of my journey was while trying to save his life, we did indeed have to rely on pharmaceutical interventions.
mm.
And eventually, in spite of the usual probiotics and supplements and what have you, the gut was seriously affected. Uh, that's when I was introduced to herbal medicine. Now, I already had an Ayurvedic background. So I got trained in Western herbalism, established a plant-based alternative protocol using my own
Mm.
homegrown, biodynamically farmed herbal blends. Like I was one of those crazy moms that, okay, I have to do what I have to do. Let's go buy an organic farm.
I just, I really want to point out that you are such a beautiful example of what can happen when you go all in. And I also want to acknowledge if you're listening to this and thinking, oh my gosh, I do not have the energy or the time, that's okay too. We're going to get there.
Yeah,
Go
that's
ahead, please continue.
yes. There is nothing, I mean, after 2.5, 3, maybe more years of being in a wheelchair, I still remember just, interestingly, poignantly, actually, a few days ago, my Facebook memories showed up where I had posted the photograph of an empty wheelchair, my son's pediatric wheelchair. And I had given that wheelchair to a little girl, patient of mine, and she wanted Brian's chair because she felt it would be lucky for her, and this was little Tegan, who is now in high school, and she did get better. So that just a few days ago, showed up on my Facebook memories. But yes, um, so that's what I did. So today, as a master herbalist, and being Lyme literate, with ILADS and CERS certified, I have a full line of proprietary, some patented, some patent pending herbal blends.
Mm.
And we currently help special needs children in 97 countries using a fully, and counting, using a fully natural plant-based approach.
It's so, okay. Some people are going to listen to that and think a lot of different things. I think the question I want to ask you is why is it, because from where I sit, it is controversial to say that, for example, an underlying Lyme infection can influence or set off a chain reaction of immune dysfunction that then leads to brain on fire and body on fire. For some people, that's controversial or rare or unknowable. Why is that true? Why do we have this? I mean, I know that you said that PANS and PANDAS is very well documented, and I know that it is. And there are many pediatricians, number one, who even either don't know about it or don't acknowledge. So what's happening here? if you know.
Yes, yes. It takes decades for information to be transcribed into medical textbooks. My son is now in third year medical school, and he's doing his thank you.
Yeah.
It's a huge blessing, a gift, and it's been a constant point of contention, frustration for him. He's doing his clinical rotations right currently, and there's just a complete lack of awareness of many of these. There are several, I mean, there are thousands of practitioners around the world who recognize PANS, pandas, Lyme, SIRS, right, mold exposure, and then there are millions that don't. Is there anything we can do about it? Well, yes, exactly what you're doing is, spread the awareness, do what we can from our side. But these are documented, well, very well researched conditions. ILADS is the International Lyme and Associated Disease Society. They have, thousands and thousands of practitioners that are members worldwide uh, that do recognize that Lyme is one of the silent pandemics
Mm.
that is slowly getting more and more worldwide recognition. Um, PANS pandas is the broad term, pediatric acute onset or autoimmune neurological or neuropsychiatric syndromes, which used to be known as pandas back in the day, 2009. That was when the thought process was that only streptococcus, the gabus, right, the group A beta hemolytic strep was the organism
Mm.
that was causing brain inflammation, autoimmunity, friendly fire, where the person's own immune system sends antibodies to attack regions in the brain,
Mhm. Mhm.
right? Causing symptoms, which many of which can be similar to autism. This was then broadened because many additional triggers were found.
Huh, I did not know that. Thank you. Keep talking.
Right. So now I have seen remarkable progress in children, I mean, across the globe, once the underlying neuro, immune, inflammatory conditions are recognized and treated. Like we need to ascertain what that little body is dealing with. I mean, various kinds of toxins
Mhm.
from microbes, and by microbial organisms, it encompasses viruses, bacteria, fungi, parasites,
Mhm.
right? Yeast, mold, all of the above. And infections, along with genetic, metabolic, hormonal detoxification challenges. It needs to be data driven. It is data driven, very objective, where we run specialized labs and based on the child's individual lab result, these are your child's results. A completely custom protocol is created for that particular child.
And
Now, yes,
I
no, go
think
ahead. Go
you've
ahead.
I think you've just described what the in air quotes problem is from a mass media mass practitioner perspective, which is and the term I have heard is bio individuality, which is not everybody responds to an exposure to mold in the same way. Not everybody's system. I was bitten by a tick recently. I am waiting my weeks to get a Lyme titer and all of that, but I'm hoping that I don't have any symptoms, right? Um, Not everybody responds in the same way to the same exposures. Yes?
Yes, absolutely. Two things, that brings me to two things. I mean, Lyme disease, there's ongoing research and a lot of evidence that Lyme is transmitted in utero.
Oh,
So again, not everyone experiences the typical, debilitating symptoms of Lyme disease. And sometimes it could just be mild anxiety, some aches and pains. And when you're young, you're like, okay, everything's fine. So that's what happened to me and to many mothers that I have come across, that we inadvertently passed the infection in utero to our children. And Dr. Charles Ray Jones, rest in peace, his research has given us a lot of information as to the typical presentation of an infant after being born, with your the rashes, the colic, the dairy issues, sleep issues. So these are the classic issues that can be seen in children where Lyme could have been transmitted in utero, right? Now, that is why that's one point. Second is I have twins and triplets in my practice, and we run their labs, and they have different results in spite of um, the same genetic makeup, right? And each one has their own individual protocol, looking at their physiological, biochemical, neurological imbalances, hormonal imbalances, and there's no one size fits all. That is where you see the best results. Um, Customize it, bio individualize it, like you said, and be patient.
Hmm. Oof. Um, I actually think that that is where we're going to pin it today. There's so much more to talk about, and I hope that you'll come back. Any final kind of things that you really need to say before we wrap up here that people need to really know about? I don't want to cut you off, but I also do want to shape this conversation a little bit here.
Yes, of course.
Yeah.
I think I have said all of the points that should be pinned
Okay. Okay.
in your mind. That don't accept. And I'm telling you, these are mothers from I don't know how many different cultures around the globe. I mean, a mom is a mom. It really doesn't matter what culture you come from. And I mean, I have physician moms and chiropractor moms and homemaker moms, architect moms, attorney moms. We all want what is best for our children. And the way they found me was they refused to accept mediocrity.
Oof. Yeah.
And they wanted something different for their child, and they were determined. They have been patient, and we are seeing amazing results. I mean, obviously, one thing if I may, please, when I say plant-based protocol, that doesn't mean that the child needs to be on a plant-based diet. No, that's not what it just means that the approach is plant-based, it's herbal, it's biodynamic. And I have children, who thrive on many different kinds of diets, all the way from vegan to carnivore.
Fantastic. I'm
It's
glad you
absolutely fine.
I'm glad you mentioned that. It's oh gosh, it is such a pleasure to talk to you. If people want to learn more about you, Dr. Dashore, what do they do? Where do they go?
My website is bionexushealth.com. So www.bionexushealth.com. Instagram, Facebook, social media, YouTube handle is Bionexus Health USA.
Perfect. We will link to all of that in the show notes. I do really hope you'll come back. And
Absolutely.
for now, thank you so much for being here.
Thank you for having me, Gabrielle. It's awesome.